If you are terrified every time you take a step because you feel or hear a grinding sound inside your knees, you are not alone. Maybe a doctor looked at your x-ray and told you that you are completely bone on bone, and now you are afraid to walk, afraid to stand up, and afraid to do any movement because you think you are destroying your joints further. You feel like your knees are scraping together like rough sandpaper, and that every step is making the damage worse. But I want to tell you something that might completely change how you look at your joints today. The truth is, the missing cushion in your knee is only half the story, and you do not have to live in fear of moving your legs. Right now, while you are listening to my voice, I want you to do a very simple check with me. Wherever you are sitting, please slide your hips back so your spine is straight against the back of your chair. Plant both of your feet completely flat on the floor, about hip-width apart. Rest your hands gently on the top of your thighs, right above your kneecaps. Now, without lifting your legs or bending your knees at all, just gently press your heels down into the floor, as if you were trying to push the ground away. Feel that muscle on the front of your thigh tighten up under your hands. Hold it right there for 3 seconds. Breathe normally, and then let it go. You just activated the most important safety net for your knees, without moving the joint even 1 millimeter. Most people believe that once the natural padding wears down, severe knee pain is an absolute life sentence. You think that because the bone is touching bone, pain is unavoidable, unless you get an expensive joint replacement surgery or rely on constant pain medications. But let me ask you a logical question. If your bones are constantly rubbing together like sandpaper, why is it that some mornings you can walk to the kitchen with almost no pain, but by the evening, the exact same knee feels swollen, hot, and completely stiff? Your bones did not magically change shape during the day. The amount of cushion inside your joint did not disappear at noon and come back at breakfast. The real reason your knee hurts so intensely at certain times is not just because the cushion is gone. It is because the structural support system around your joint, specifically that thigh muscle you just touched, has completely shut down. When that muscle goes to sleep, your knee loses its natural shock absorber, and every single ounce of your body weight slams directly into the bone. Today, we are going to wake that support system up, stop the grinding sensation, and give your knees the natural protection they desperately need. To understand how to fix this, we have to look at a silent shift that happens inside every human body after the age of 50. Medical professionals often refer to this as age-related muscle loss, but you can think of it as the silent thinning of your body's natural padding. Year after year, without you ever realizing it, your body undergoes a mechanical decline. It begins when the tiny nerve signals connecting your brain to your leg muscles start to fade away. Because these communication lines weaken, your body stops maintaining the number and the size of your muscle fibers. They slowly shrink, and the overall quality of your muscle contractions drops. The result is a creeping weakness that makes your movements a little slower, your balance a little less certain, and your risk of experiencing a sudden stumble or fall much higher. Think of your front thigh muscle as a heavy-duty shock absorber on a car. When you were younger, that shock absorber was thick, springy, and perfectly capable of soaking up all the impact every time your foot hit the pavement. But as this silent thinning takes place, that plush mattress of muscle becomes thin and less responsive. In people dealing with knee wear and tear, this weakness is even more complicated. It is not just that your front thigh muscle is getting smaller from disuse. It is that your brain is losing its ability to properly activate the muscle tissue that is still there. The muscle literally forgets how to turn on when you need it most. On top of that, the internal quality of the muscle changes, filling up with stiff tissue instead of healthy, elastic fibers. This means the muscle can no longer absorb the force of your body weight, forcing your knee joint to take the entire blow directly and brutally. This specific front thigh muscle is directly responsible for almost every single independent movement you make throughout the day. It is the exact engine you use to push yourself up out of a deep living room chair, to walk down your driveway safely, to step up and down the stairs, and to bend down gently. When this front thigh muscle, along with your calf and hip muscles, loses its strength, your knee joint is left completely defenseless. That is why you feel that sharp, nagging ache whenever you change positions, walk down a slight slope, or try to stay on your feet for more than a few minutes. Mechanically speaking, your knee is hurting because it is being asked to do a job it was never meant to do alone. It is carrying your weight without a single helper. And that is why we must focus on waking these helpers up. Now, let us dig deeper into why this front thigh muscle turns off in the first place. Because this is the real crisis nobody explains to you during your quick office visits. When you suffer from long-term knee wear and tear, something strange happens to the electrical communication lines between your brain and your leg. Your brain attempts to send a clear signal down to your thigh, telling it to contract and protect the joint. However, due to a protective reflex caused by joint irritation, the switch inside the muscle fails to flip completely. In clinical research, this is known as a reduction in voluntary muscle activation. It means that even when you are trying your hardest to stand up or walk, your brain can only wake up a small fraction of the muscle fibers. The rest of the muscle remains completely asleep, leaving your knee joint totally exposed. To make matters worse, it is not just that the muscle is shrinking, the very quality of the tissue inside your thigh is changing. Imagine a brand new, springy rubber band that slowly becomes cross-contaminated with stiff, unyielding strings of twine. That is exactly what happens when healthy muscle fibers are gradually replaced by stiff connective tissue. Because the muscle is now choked with this stiff material, it loses its natural elasticity. It can no longer act like a soft sponge that catches and absorbs the heavy impact of your daily movements. Let us look at the physics of a single step to see how this hidden crisis destroys your comfort. Every single time your heel strikes the ground while walking, a shockwave of force travels directly up your leg. If your front thigh muscle is awake and active, it acts like a premium brake pad, catching that force and dispersing it safely throughout your thigh. But when that muscle is disconnected, it cannot manage the load. The force bypasses the muscle entirely and slams directly into your raw bone endings. This structural failure alters your knee angles and increases the harsh, twisting forces inside the joint with every single step you take. This is the exact reason why rising from a dining chair, walking down a gentle slope, or stepping down a flight of stairs feels like such a terrifying chore. Your knee joint is literally being crushed under your own body weight because its primary defender has left the post. You feel unstable, you lose your independence, and you begin to fear every movement because your body has lost its ability to control how weight is distributed across the joint. But you must understand that your body is not permanently broken. It is simply sending the wrong signals, and we can absolutely retrain it. When you realize your knees are wearing down, your natural instinct is to try and fix it by staying as active as possible. You push yourself to take long walks around your neighborhood every morning, or you force your legs into deep squats because a health magazine told you that you need to strengthen your lower body. You believe that if you just walk through the stiffness, your joint will lubricate itself and the pain will eventually fade away. You assume that pushing through the discomfort is a badge of honor and a sign of healing. But let us look at the reality of what is happening inside your leg. Pushing through sharp joint pain when you are bone on bone is not making you stronger. It is actively accelerating the friction. This is what I call a false friend in joint health. You are performing high-impact walking or heavy bending to achieve better mobility. But because your brain has temporarily turned off your front thigh muscle, you lack the core stability to handle that weight. Without that muscular support, every extra mile you walk, or every deep squat you force your body into, creates the exact opposite result. Instead of building healthy muscle tissue, You are hammering your unprotected bone endings together under the crushing force of gravity. Let us break down the physics of why this happens. Your knee joint is designed to distribute your body weight evenly across a flat surface. When your thigh muscle shuts down, your leg mechanics shift completely. Your knee begins to tilt slightly inward or twist outward with every single step you take. This structural tilt alters your knee angles and concentrates all your body weight onto one tiny, already worn-out section of the joint. Think of a car with a tire that is completely out of alignment. If you keep driving that car at high speeds on a rough highway, that specific tire will wear down to the metal and blow out much faster than the others. Power walking on an unstable, unaligned knee joint is doing the exact same thing to your bone. Your nervous system reacts to this constant irritation by triggering a massive warning alarm. It sends intense pain signals to lock up the entire area, leaving you feeling tighter, weaker, and more miserable the following morning. I am going to give you a precise 5-minute routine to safely awaken these muscles right from your seat. But I must give you a critical condition first. If you try to perform these movements while ignoring your body's true limits, you can make the inflammation worse. We must entirely avoid deep joint bending and dynamic impact for now. Instead, we are going to use static holds, methods where your leg muscles generate maximum power while your knee joint remains completely still. This creates a natural, living brace that stabilizes your leg, allowing you to build strength without a single moment of painful bone-on-bone friction. To help you take control of your mobility right now, we are going to walk through a safe, scientifically supported routine that I call the 5-minute knee reset protocol. This protocol is specifically designed for sensitive joints because it uses static muscle activation, meaning your muscles work hard while your knee joints remain perfectly still and protected. You can perform this routine once or twice every single day, preferably in the morning before you start your daily activities, to build what functions like a living brace around your legs. Let us begin with the first movement in our protocol, which is called the seated quads activation. The best time to do this is right now while you are sitting down. Make sure you slide your hips back so your spine is supported by a sturdy chair, and place both feet flat on the floor. Rest your hands gently on your thighs, right above your kneecaps. Now, focus on your right thigh. Without moving your leg or lifting your foot, squeeze the muscle on the front of your thigh as if you are trying to straighten your knee against the chair. Keep breathing evenly. Do not hold your breath. Hold this contraction for 5 to 10 seconds. Then slowly let it go and rest for another 10 seconds. Perform this 10 times on your right leg, then switch to your left leg. The mechanism here is simple. This contraction sends a direct signal to wake up your front thigh muscle and tells it to start absorbing the impact of your weight again. A common mistake is tensing your shoulders or jaw. Keep your upper body completely relaxed. You should feel a gentle warmth or a controlled tightness in your thigh. If you feel a sharp pinching pain inside the joint, you are squeezing too hard. The easier version is to simply press your heel lightly down into the floor to get the same muscle contraction. As a progression scale, start with a 5-second hold this week, and slowly work your way up to a 10-second hold next week. The second movement is the seated extension hold. You should do this immediately after the first step, while your leg muscles are awake. Sitting securely on your stable chair, slowly lift your right foot and extend your lower leg out in front of you. Only raise it to a position that feels comfortable and close to straight, making sure there is no sharp pain. Hold your leg at this height for 5 to 10 seconds while breathing calmly. Then, lower it back down to the floor with complete control. Repeat this 5 to 10 times on each side. Medical research shows that training the thigh muscle with the leg extended helps reduce joint stiffness and improves daily function far better than deep knee bending. The most common mistake is slouching forward or swinging the leg up with momentum. you should feel your front thigh working firmly, but you should not feel any grinding or snapping inside the kneecap. If this feels too heavy, the easier version is to lift your foot just a few inches off the floor. The progression for this step is to gradually extend your hold time up to 15 seconds as your leg control improves over the next few weeks. Now let us move to the third step of our routine, which is called the towel press activation. This specific movement is incredibly helpful if you struggle to fully straighten your legs or feel a stiff, tight resistance behind your kneecaps. For this setup, you just need a standard hand towel rolled up into a small, firm cylinder. You can stay right in your chair, or you can do this lying down on your bed. Take that rolled towel and slide it directly underneath the hollow of your painful knee. Keep your heel resting gently on the floor or mattress. Now, imagine you are trying to squash that towel flat against the surface beneath you, using only the back of your knee. Press down firmly and simultaneously pull your toes back toward your shin. As you press down, you will feel the front of your thigh tighten up immediately. Hold this steady pressure for 5 to 10 seconds while keeping your breathing slow and relaxed. Release the tension slowly. Rest for 5 seconds and repeat this 10 times before moving to the other leg. The biological purpose of this step is to wake up your stability muscles at an angle that keeps your joint completely stress-free. A common mistake is gripping your breath or letting your opposite hip lift off the seat. You should feel a deep, satisfying engagement in your thigh and a firm pressure against the towel. If you feel a sharp, biting pinch inside the joint, simply reduce the towel roll thickness or press down with half the power. Next, let us transition to the fourth step, which focuses on your lower leg and is called the supported balance hold. While your thigh muscles control the weight coming from above, your calf muscles are responsible for managing the impact coming up from the ground. To do this safely, stand up slowly and step behind your sturdy chair or stand facing your kitchen counter. Place both of your hands firmly on the backrest or counter for total balance support. Keep your feet flat and hip-width apart. Now, slowly peel your heels off the floor, rising up onto the balls of your feet just an inch or two. You do not need to go as high as possible. We want a controlled, stable position. Hold your heels steady in the air for 5 to 10 seconds. Breathe normally, and then lower them back down to the ground with total control. Repeat this 10 times. This builds functional ankle stability, which directly changes how your leg absorbs weight when you walk. The most common mistake is leaning your entire chest forward onto the chair, or letting your ankles wobble outward. You should feel your calf muscles working and a sense of sturdiness in your ankles. If standing feels too unstable, or you suffer from frequent dizziness, the easier modification is to stay completely seated and lift your heels while pressing your toes firmly into the floor. Together, these 4 steps form the complete golden protocol for knee stability. By performing this 5-minute sequence consistently, you are sending a daily signal to your nervous system that it is completely safe to turn your leg muscles back on, creating a natural shield for your joints. Now, you might be wondering, Sophia, how long do I actually need to practice this routine before my legs start feeling sturdy again? Let me look directly at what clinical science tells us. Because these movements are backed by real medical trials conducted on people just like you. Clinical researchers have mapped out the exact timeline required to trigger true mechanical changes inside your lower body. For example, a rigorous study tracked mature adults between the ages of 45 and 70 who were managing severe knee wear and tear. The clinical data proved that practicing these exact, gentle, static leg extensions for just 4 weeks dramatically reduced joint stiffness and restored comfortable daily walking function. In fact, Holding the leg in a nearly straight position allowed the participants to clear out morning stiffness much faster than traditional bending exercises. Another clinical trial showed that a simple 5-week routine of static thigh contractions resulted in a massive boost in leg strength and noticeable physical comfort compared to those who did not exercise. Furthermore, when researchers compared individuals who only used standard over-the-counter pain medications against those who combined their medication with these precise static exercises, the exercise group experienced a massive reduction in daily symptoms within 4 to 6 weeks. For your daily routine at home, you do not need to spend hours exhausting yourself. If you are over 50 and your joints feel fragile, you only need to commit to 5 minutes a day. Select 3 or 4 of the static movements we just practiced. Hold each gentle squeeze for 5 to 10 seconds, and repeat them 5 to 10 times on each leg. Always give yourself a brief, relaxing breathing space between each repetition. Consistency matters far more than intensity, because your nervous system needs a regular, calm signal to rebuild its protective strength. As you build this habit, you need to know exactly how to read your body's internal dashboard. A normal, positive sign that you are performing the protocol correctly is a mild, comfortable warmth or a slight sense of fatigue directly in the front thigh muscle. This is a wonderful signal that your shock absorbers are waking up. However, I want to give you a very serious set of safety guidelines that I call your red light alerts. You must never attempt to push through severe distress. If you ever experience a sudden, sharp, shooting pain inside the knee joint, increased swelling, skin that feels hot to the touch around the kneecap, or deep muscle spasms that lock up your leg into the following day, you must stop the session immediately. Additionally, if you are currently managing chronic underlying conditions such as heart disease, unmonitored high blood pressure, diabetes, advanced osteoporosis, severe lower back pain, or frequent dizziness, you should exercise extra caution. If you are recovering from a recent total knee replacement or experiencing a sudden flare-up of acute joint inflammation, please do not try to push through it on your own. The clinical trials I mentioned earlier carefully selected participants with stable health profiles. Therefore, if you have any of these medical complications, it is absolutely vital that you speak with your primary physician or a licensed physical therapist to customize this routine safely for your specific needs. Your safety is always our highest priority. As we wrap up today, remember that waking up your leg muscles is the crucial first layer of defense. But true joint longevity comes from combining this 5-minute routine with smart daily choices. Think of your knee like a house. You have just reinforced the structural walls, but we also need to manage the weight on the roof and protect the foundation. If you are carrying extra body weight, even a modest reduction can relieve thousands of pounds of cumulative pressure from your kneecaps over the course of a single day. When you go for your daily walks, break them down into shorter, manageable paths throughout the day, instead of forcing your body through long, exhausting distances all at once. Make sure to wear supportive shoes with stable, non-slip soles to give your feet a predictable, well-cushioned surface. Your body is incredibly adaptive, and it constantly modifies its structure based on the mechanical signals you send it every single day. Do not try to silence the warning signals with a pill. Instead, send the right message to your nervous system through controlled, pain-free movement. Now that you understand how to build this natural muscular brace to protect your bones from friction, you are completely ready for the next logical step in your recovery. You might be wondering if there is a way to directly support and nourish the actual cushion inside the joint itself. What if there is a simple, natural method that costs less than $2 right at your local grocery store that helps maintain and build the health of your knee cartilage? It is a low-cost approach that many busy clinics simply do not have the time to discuss with you during a standard 10-minute checkup. In my very next video, I am going to break down the science behind this $2 remedy that supports knee cartilage from the inside out, giving you the exact steps to nourish your joints naturally. Click on the video appearing on your screen right now, and let us continue this journey to reclaim your mobility and live completely free from fear.